So, Diana, when did you write the thorax book, the book on the thorax, and what promoted you to do this?
Wow, big question. So, in the mid-1980s, 85, 6, and 7, I was working with a physiotherapist. Her name's Jan Locock. And our interest in the thorax was piqued when we had a patient in the clinic, and I can't remember who the therapist was that this had happened to. Somebody manipulated the thoracic spine of this patient, and when the patient went out to the reception, they collapsed, they fainted. And Jan and I had a conversations around, we don't have any stability tests for thorax. And I was teaching courses in the manual therapy system at the time, and their manipulation courses, and there were no safety checks for the thorax. And we didn't even really understand the coupling mechanisms of side flexion and rotation, or the biomechanics of the region. And yet here we were teaching manipulation techniques without the fundamental understanding of what the biomechanics were and what should happen. So Jan went on to develop some really precise, specific stress tests for the various ligaments and the disc in and around the thorax at that time. And I dug in deep to the biomechanics, osteo and arthrokinematics. And I was on a flight to Ottawa. This would be in the late 1980s, 1988, something like that, to teach a manipulation course. And I was reading, I had gathered up all the evidence and the research I could find around biomechanics of the thorax. And there was one article written by Manohar Punjabi in 1976.
Wow.
Where he'd actually taken what he thought was a functional spinal unit, but the ribs were cut 3 centimeters lateral to the costotransverse joint. So it certainly wasn't a complete thoracic ring as we define it today. It was just the spinal component. And then he added all these levers and loads and things to the segment, and then described the resultant translations and linear movements between the vertebra and flexion, extension, side bending, and rotation. And as I was working my way through this article, I was sitting on the plane. There was just this sudden understanding in a moment of the osteo and arthrokinematics. It was like a package of knowledge that just came into my head. I didn't figure it out. It's the bizarrest thing. Anyway, I stayed up till 4 in the morning that night writing it out. And then I taught it the next day.
No way.
Yeah, taught it the next day.
Best form of learning is to teach.
Yep. So didn't even see one, do one. It was just, I think this works. Let's teach it. And, that's what we did in the 80s.